To all my hustlers, dreamers, love dealers, I'm that kind of girl. Work hard, play hard, for my own heart, might just rule the world. I'm on fire, can you feel the heat? You can try to, but you can't stop me.
This is Marcy Burrows and Carol O'Savin hosting the Midlife Mavens podcast, where we chat candidly about sex, love, relationships, and life for women in their 40s, 50s, 60s, and beyond. We're both psychologists who specialize in relationships and sexuality, but this isn't therapy. Thanks for joining us to discuss the ups and downs of life in the middle. We hope our conversations inspire and empower you.
A quick disclaimer. We're both psychologists who specialize in relationships and sexuality, but this isn't therapy. This podcast is for educational purposes only and is not a substitute for professional services from a psychologist or other qualified mental health professional. The use of any products or services purchased by you as a result of this podcast does not create a healthcare provider-patient relationship between you and any of the experts affiliated with this podcast. Let's get into today's episode.
Welcome back to Midlife Mavens podcast, where we're trying to make midlife your best life. Today, we're going to talk about the changes that we may experience with mental health in this phase of life, largely related to menopause and hormonal changes.
So much that we could talk about in this episode. We're going to have to be concise.
Absolutely. And I think historically, a lot of women are diagnosed with depression and anxiety, different mood disorders in this phase of life, and it's never attached to the other changes their body's going through. And so they think there's something mental health wrong with them versus this is a normal symptom of the changes that my body happens to be going through at this phase in my life.
And when our physicians or our medical providers aren't informed enough about the impact of menopause, or really, would you agree with me, Marcy, that a lot of these kind of mood, especially the mood changes, seem to show up in closer to perimenopause than actually menopause? And so then when our providers aren't informed enough about what can happen to a woman emotionally during perimenopause, they just assume that it's a mood disorder and not related to their hormone shifts. Do you think that's accurate?
Absolutely. And I think that can be even more so the case for women who might enter perimenopause early, as well as for women who enter it on time. I've had a client recently who is starting to have some symptoms in her 30s that seem consistent physiologically with menopause. And then it's got me wondering, well, hey, how is this related to the anxiety that we're seeing and some of the depression that we're seeing? And I think there's probably a lot of overlap. And then if you have symptoms of anxiety or depression or any mood disorder and you go to a psychologist or a therapist, we're certainly not trained. And I didn't have any courses that covered menopause. I think we heard a little bit about menstrual issues and PMDD, but not even a lot with that. But at least I know enough to think, oh, okay, is there a cyclical component to this? But I've never had any training related to the impacts of menopause until my sex therapy certification courses.
Isn't that interesting? We could just go back to the societal impacts that we've talked about, I think, in every episode about the medical community is made up primarily of males, and there's just not enough research done about women and how life changes might impact women differently than they impact men. And it brings back that frustration that we have about the fact that there's just a real dearth of information about menopause and especially perimenopause, it feels to me. Menopause, it's a clear marker, right? You've stopped your your monthly cycle has ended for a year. That's when you know that that's officially the designation of menopause. But perimenopause can start 5, 10 years before your cycle ends, and a lot of these kinds
Right.
of mood changes that we're talking about especially can begin to set in during perimenopause, not just menopause.
Yeah. And when I think about as a mental health provider, when somebody comes to me with symptoms that are consistent with some of the changes that we might notice in menopause, I'm certainly going to start encouraging people more regularly. Since focusing more exclusively on sex therapy, I frequently send people to their OBGYNs or men to their primary care doctors for looking at hormone levels. But it's not something historically that I did much of. I frequently would refer people to have their thyroid checked because I knew that could contribute, but never really thought about this part. It's just not part of how we're trained.
I guess I'm not really surprised, but your sex therapy training includes more information than 4 years of graduate education, 4 or more years of graduate education in psychology.
Well, if you think about it, I didn't have any sex therapy in my training at all. We just didn't talk about sex in my training much at all, other than we looked a little bit at LGBTQ plus issues and working with LGBTQ plus clients, but never looked at anything related to sexual disorders, sexual dysfunctions, relationship issues around sex. I mean, none of that was covered.
Yeah.
We got trauma training, and that's about it. Yeah, I do think that some programs have a little bit. Now, I taught one class at UT, but it was an elective, and it's only if I want to teach it that they have it. So I have to pursue teaching it in order for them to have it right now. But I do think there's probably other programs that maybe have one course, but that's it. Well, going back to mental health issues, I think the things that are most common to see with perimenopause and menopause are going to be depression and anxiety, an increase in ADHD symptoms. Also, I've had clients that have their first manic episode and are diagnosed for the first time with bipolar disorder in this phase of life. It is probably there underlying, but the hormone changes triggered their first manic episode. They may have struggled with depression before, but never had the upswing, at least extreme enough to be diagnosed until they hit perimenopause or menopause and had those hormonal fluctuations.
You said that to me a little bit ago, and I was shocked by that. I've been in this field 30 some years. I've never heard any mention of that. Marcy actually looked it up to find out what was it like 14% or something? A 14% higher incidence of bipolar disorder after hitting perimenopause?
It was
Oh,
112% of more active activity of bipolar disorder in menopause. So that would be people, that's going to include a lot of people who already had a diagnosis, but it's exacerbated with menopause, which I think is important for women who have bipolar disorder to be aware that this is something to look for and for providers to be evaluating in their clients with or patients with bipolar disorder as they hit those ages.
what age? This is a consultation question, Marcy. At what age would you start to make some connections in your own mind with your clients about thinking, I wonder if this might be hormonal? Are you thinking I'm thinking early 30s, mid 30s at the latest. I'm going to start if they're presenting symptoms that are consistent with what we're talking about, I'm going to start thinking about hormone issues, not just mood issues.
Right. Right. And until recently I wouldn't have thought that in their 30s. But like I said, I had a client just recently and I thought, "Whoa, wait a minute. This is earlier than I would expect." But with the physical changes that she's describing, it kind of makes sense that maybe the mood stuff that has been a lot harder lately may be related to that as well.
That reminds
Yeah.
me, I did have a client barely into her 30s, 31, maybe 32, who was really struggling to maintain consistent mood after significant work around this issue, and she did go see a functional medicine physician who tested hormones, and her hormones were completely out of whack. And when the physician
Mhm.
prescribed some hormonal supplements to help bring things back into balance, it made a huge difference in her mood stability. She was never bipolar, but she was profoundly, yeah, I think profoundly depressed would be accurate. There were times where I was worried for her personal safety. And that just occurred to me that with that one client, I can think of a situation where we probably should have been exploring that sooner than we did. And she was, like I said, 31 or 32.
Yeah. And as a sex therapist, one of the frequent things that I work with is mismatched libidos or lower drive. And in my heterosexual couples, it's usually, not always, but usually the female that has the lower drive. But I have had a couple of different times where the woman has started hormone replacement therapy and basically it's the work is done.
Her libido has
The
returned.
mismatch.
Yeah. Yeah.
Yeah. Or, there's still maybe some stuff to talk through and differences in, like we've talked about in previous episodes, responsive versus spontaneous arousal, but there's a lot less of a disparity once there's some hormone replacement.
We wanted to briefly interrupt the episode today and remind you that Marcy and I are both psychologists and would be happy to consider working with you if it seemed like it would be helpful. If any of the content that we've talked about in any of our episodes brings up issues that you would like to explore with a psychologist, we want to make sure that you all have our contact information.
If you're interested in working with either one of us, we both offer 15-minute consultations to assess if it seems like would be a good fit for your therapeutic needs. You can go to my website, which is Marcy, M-A-R-C-I, Burroughs, B-U-R-R-O-U-G-H-S, P-H-D, C-S-T.com, or Carol's website, which is drosaben.com, drosaben.com. We also have our websites in the YouTube channel notes for this episode. And now back to our episode.
So we've been talking about how it can be difficult to separate out what mood issues that are presenting in a client or in a individual might be related to hormones or not. It could go either way. One of the other things that I think makes that challenging is the common myth is when women hit the change, they become mm, irritable and difficult to be with. I think that often that can also be a hormone related thing that is a cover for depressed mood, irritability, anger. Many women are reluctant to be vulnerable and talk about their depressed mood and sadness and grief and loss, but it's easier to push people away and be irritable and angry even as a cover for that. And so often that gets couched in menopause as, oh, you must be in the change, when it could really truly be a mood issue that's presenting as well. Because there are a lot of things to be depressed about when we hit perimenopause and menopause. Life is changing significantly.
And as we're covering in all of our other episodes, it's all these hormone changes, but then there's also a lot of life changes and transitions happening at the same time. So there's layers of things that are contributing to mood issues and anxiety, increases in anxiety. And yeah, I think a lot of women experience some feelings of rage and anger during this phase of life that are in part hormonal, probably in part because things are changing so much.
Well, yeah, you talk about mismatched libidos a lot. If there's a mismatch of libidos and the woman in the relationship is not feeling sexy, to go back to one of our previous episodes, and the man is feeling sexy or a desire for some sexy time, that can start to feel like pressure on the woman. It can start to feel like rejection on the man's part. It can be, if there's
Mhm.
no, back to our common theme of communication, if there's no communication about that, it can be really confusing what's going on.
Absolutely, and it could really start to feel like a chore for the woman. I hear a lot of women saying that sex really feels like a chore now, and then it's something that just keeps building. The more it feels like a chore, the more you don't want to do it, and it just kind of snowballs from there. It just leads to a lot of relationship issues. Yeah.
I remember when I was talking to my physician about it, about hormone changes related to menopause, she said that oftentimes she'll start talking about hormonal changes in menopause with some of her older clients, and she'll inquire about their sex life, which takes them by surprise. And then they'll say that they haven't had sex in a really long time. And in digging, my physician will say she understood that to be probably more hormonal related than the woman just doesn't want to have sex with her husband anymore. And so she'll say, you know, we we can help with that. Like, if you would like to have sex again, if you would like to enjoy having sex again, I can maybe prescribe some hormone replacement that could help with that. And a lot of her clients are just so surprised by it could be that easy.
Yeah, and I think again that goes back to people not talking about it. And then also there's this myth that after a certain age people just stop being sexual. That is completely untrue. I mean, there's people into their 80s having great sex lives. It may not look like it looked in their 20s and 30s, but they're still having great sex.
Are you familiar with the term lesbian bed death?
Yes.
I I I suspect, this is just my hypothesis, I have no information to support whether this is true, but I suspect the phrase lesbian bed death got coined when two lesbians had hit menopause and their arousal and desire just went away and they didn't know what to do about that, right? And they were both comfortable with that because they were both experiencing hormonal changes related to menopause or perimenopause. That's my hypothesis.
Well, I also think if you have two lesbians in a long-term relationship and you kind of look back at what we talked about a couple of episodes ago, where in new relationships, it's normal for both partners to have spontaneous arousal, but in the overwhelming majority of women, when there's 70 to 80% of women in long-term relationships don't maintain that and they have responsive arousal. So if you have a lesbian couple, you've got very likely two people with responsive arousal. So it's less likely somebody's going to initiate.
Right. Because of all of the things that we've talked about in those episodes. I just made that connection, though, between the difference having two people experiencing perimenopause or menopause symptoms in a relationship versus only the woman experiencing it. Probably brings up a bit more tension in heterosexual relationships than it might in same gender relationships, just because both both people in
Yes.
a lesbian relationship are experiencing the same decrease.
Yeah. So hopefully there's more understanding and empathy there for going through the same
Yeah,
thing,
right. Hopefully.
assuming they're similar ages.
Right. Which is also an issue if they're not, and there's a younger
Right. Yeah.
woman with an older one, a significantly older woman, they might not hit perimenopause, menopause changes at the same time, then that is likely to create the same kind of conflict that you're talking about in heterosexual couples.
Yeah. Yeah. One other area that we haven't talked about in terms of mental health is that there is an exacerbation of ADHD symptoms with menopause and hormonal changes. And so there's issues with executive functioning, the brain fog that we hear a lot about, and trouble finding words. And so that's another thing that a lot of women are being diagnosed with later in life, that maybe it was there, but it wasn't as obvious. until it got worse with the hormone changes and shifts.
I just had this conversation, ironically, yesterday with a client who is the appropriate age of perimenopause and is really struggling with some significant executive functioning skill deficits. And it's starting to impact some things that she needs to be doing in her life. And I made that connection for her and suggested that that might be something that we need to have her talk to her physician and medical provider about. I know what I was taught when I was in school was ADHD is one of those conditions that has to be present in childhood in order to be diagnosed in adulthood. You have to be able to look back and identify those kinds of symptoms and deficits in order to be able to diagnose it as an adult. But that doesn't appear to be true once you start talking about perimenopause.
And I think in general, it's shifted. There's a lot more people that are being recognized as having ADHD later in life and being diagnosed for the first time later in life just because it was missed. And that's so common with women because usually with women or girls, they tend to be more hyperactive within themselves. So it's more of like an active mind, ruminating or daydreaming. And so it's not as obvious because they're not causing the same kind of problems as maybe traditionally. I think we think of the very impulsive little boy that can't sit. I was actually the very impulsive little girl that couldn't sit still. So it was more obvious for me, but I never was formally diagnosed until I was older. Though looking at my report cards, you could see it. But I can tell a big difference when I went through perimenopause and menopause. And my father had dementia. My father had Lewy body dementia. And that's been a big source of anxiety for me personally is I think, oh, I can't find this word. Is this it? Is this the start of me having Lewy body dementia? Or, is this going to be dementia versus executive functioning? And so it's been a big relief to kind of understand it more from the perspective of, yes, this is normal for going through perimenopause, especially already having ADHD, that combination is going to make it harder sometimes to find that word or to find my car keys.
Isn't that funny? I could hear, as you were talking about that, I could hear the relief in your voice from being able to maybe not completely take the fear of Lewy body dementia off the table because of your family history, but reduce the fear. Oh, this could be something else. This doesn't necessarily have to be this horrible disease that I saw my dad suffer with. And that was exactly the reaction I got from that client last night when we were talking about the fact that this could be her executive functioning deficits could be related to her hormone shifts because she's at that age. And she was like, oh, really? It's just not another example of how I suck at managing things in my life. So often as women, we're taught to suck it up, don't talk about it, figure out a way to compensate. And it's a burden that is not an easy one to carry. And when you've got a lot of things on your plate, as this client does, that can be really hard. And the relief on her face last night and in your voice that I just heard, it was the same.
Yeah, definitely is a big relief to realize that there's other options. But also, I think I spoke in a previous episode about the Oprah Winfrey special on menopause, and there's a neurologist who is on that special. And one of the things she talked about is that women should be looking into hormone replacement therapy at their first hot flash, because she said that there are parts of the brain that actually atrophy, I think is the word she used, and it starts almost immediately, and that part can't be undone. And so there is a correlation between dementia and, she was talking about how women have more Alzheimer's than men in general, and that there may be this connection to the atrophy that happens with the decrease in hormones, that, not only are you having vaginal dryness, eye dryness, mouth dryness, that even your brain is drying up to some extent as well, but that can be treated. And so she was advocating for women to, as the first hot flash, to start treatment.
That I think is really good information. It does sound like that. You said everybody should watch that episode of Oprah. I'm going to have to go back and see if I can find it. It sounds like it provided some really good information, because I read that recently in a book talking about the hormonal changes related to menopause and perimenopause, but I had forgotten it until you mentioned it, that's lots of things can start to dry up, I think is a really good way to think about that. And if we can provide more hormones in a safe way, there are some downsides to hormone replacement for some women, but if physicians can replace some of those hormones safely for women, they don't have to experience, kind of like my physician said to her clients, well, it doesn't have to be like this. It doesn't have to be a chore to be living your life at this point.
Maybe that would be some good episodes in the future too, to either watch and talk about that Oprah special or to read some of the books. There were several people on there that wrote books about menopause, and those might be some interesting episodes in the future that maybe we can take a look at, or look at having some specialists around this stuff on as well.
That's a great idea. That's a great idea. I've got a stack of books over on the corner of my desk that are all about related to menopause and perimenopause. And maybe we could do a little mini book club just between you and me, or have some other guests on and
That would be
have a
great.
group talk about some of the books that we're reading.
Yeah, that'd be awesome. Again, we'd love to hear what you guys want to hear from us. So if there's more related to mental health or any of the topics that we covered today, please let us know by going to our Facebook page or commenting in YouTube on this episode. We'd love to talk about what you want to hear about.
We look at all those places for comments that you might be leaving us. So feel free to engage, and we'll see where we want to go in future episodes. But thanks for joining us on this episode of Midlife Mavens, and come back in a couple of weeks for our next episode. We're going to help you make midlife your best life. This has been Marcy Burrows and Carol O'Sabin with the Midlife Mavens podcast. As psychologists, we are big advocates for therapy. If anything in today's conversation left you feeling like there's more that you would like to explore, we encourage you to pursue therapy. In today's episode notes, we've listed links for several directories you could use to find a therapist who's a good fit for you. Thanks for joining us today. We look forward to seeing you in a future episode. Be sure to visit our Midlife Mavens Facebook page to share your ideas about future conversations.